definitely do be nice.
Namaskar. On behalf of Maharashtra University of Health Science and Mumbai Vaidya Sabha, we welcome our respected doctors, our professors, students, and honorable citizens to this detailed, well-studied and informative lecture series of Charak Nirupan. Every day, there are eminent speakers. I am with Vinod Mehta, and today our esteemed speaker is Dr. Mrudula Rajput. So before we start, we'll start with the Dhanvantari Vandana. Om Piyushapani Sakrit Kundalam Chaturbhujacharu Vishala Netram Sarup Jananam Sukha Shanti Dainam Dhanvantari Tvam Shirsa Namamaha Udapita Bhishana Jalodhara Bhara Bhugna Shocham Dashama Pagata Sutta Jeevitasha Tvada Pada Pankaj Rajomrita Digdha Deha Martya Bhavanti Makarodhaja Tulya Rupaha मृतपाय व्यक्ति को भी अमृत में काया देने वाले भगवान धन्वंतरी को नमस्कार करते हुए हम इस सत्र की शुरुआत. Friends, we are now coming to the end of this lecture series, and we request you to send your feedback in a short video of just 1 minute from your busy schedule on a WhatsApp number 9821073911 and email you can see on the screen, that is drshymv3s@gmail.com, and another email ID ayushmuhs@gmail.com. So friends, let me introduce our today's esteemed speaker. She is one of our favorite speakers, Dr. Mrudula Rajput. She is BMS from R.A. Podar Medical College, Mumbai. She is MD in Kaya Chikitsa from KGMP, Mumbai. She is MA in Sanskrit, so there's a feather in her cap. And one more, that she has certificate course in German language. So we are very much hopeful with her that she may translate our Grantha from Sanskrit to German and spread our Ayurveda. She is practicing at her own at Shri Vishwamay Ayurveda Clinic in Panchakarma Center at Virar, Mumbai. And she is Ayurveda consultant at 2 hospitals, Nirmal Health Clinic and Sai Samarth Hospital at Virar. So over to you, Dr. Mrudula Madam, for today's subject. It's very critical subject, Nidan Chikitsa and Sannipat Jwar Chikitsa Siddhant Vivechan. So thank you very much. Over to you, Madam.
Thank you, sir. Am I audible?
Yes, perfect.
Shri Dhanvantare Namaha, Shri Gurave Namaha. Good afternoon, everyone. Sir, can I share my screen?
Yes, definitely.
Is it visible, sir?
Yes.
Yes, madam, perfect.
Good afternoon, everyone. My humble regards to all the teachers and students of Ayurveda faculty. I am feeling very grateful to be a part of this lecture series, Charak Nirupan, once again. Many thanks to Maharashtra University of Health Science and Mumbai Vaidya Sabha for this opportunity to share my views. Thanks to all respected dignitaries and coordinators too. Today's my topic is Sannipat Jwar Chikitsa Siddhant Vivechan. Dr. Mehta sir has already made my job very easy, as we have already heard him in previous lecture about Jwara Chikitsa Siddhant in detail. So as he said, Jwara is known to be the king of all Vyadis. Sarva Rogagrajo Bali, that is Jwar Pradhano Roganam. Thus, it is discussed in detail at the very beginning of Nidan and Chikitsa Stan of all Granthas. This itself explains the importance of Jwara. It is the biggest adhyay dedicated in almost all Grantha for Jwara. The most important to study and different to treat, but still neglected, I feel, because during academic life, this chapter is often skipped, thinking lengthy and a bit boring, I guess. ज्वर पहले से इतने बड़ा, फिर समझने की कोशिश करते करते जब सन्निपात तक पहुंच जाते हैं तो और confusion. Then students skip the part of सन्निपात ज्वर mostly, often, very often, thinking that practice में कहाँ देखा जाएगा ज्वर, और उसमें भी फिर सन्निपात, वो तो दूर की बात है. Very less likely to face such conditions, as explained in Sannipat Jwar. But days have changed. People are thinking of Ayurveda for Jwara too, instead of taking some antibiotic pill to suppress it. And that's what the positive side of COVID, we can say, thanks to COVID-19. Now, as a practitioner, or we can say clinician, though we get to see a very few patients of actual Jwara in Vegavastha or Tarunavastha, there are number of situations where we find Jwara, especially Sannipat Jwara, in uh, chronic deep-rooted diseases, or diseases which are with poor prognosis, we can say, wherein some or other way these lean dosha which contribute to Darun Vyadhi Samprapti. And so it's important to learn Jwar in detail. As we all know that it is said in Vruddha Vaidya Parampara, जो पुराने वैद्य है वो हमेशा ऐसे बोलते हैं कि if we understand Jwar thoroughly, it is easy to understand rest of all Vyadhis in terms of Nidan, Lakshan Samprapti as well as Chikitsa Siddhant. चरक संहिता की जो प्रश्न सोक्ति है, यदि हस्ति तदन्यत्र यन्य हस्ति न तत्क्वचित, it can be applicable for Jwara too, if it wouldn't be Atishokti if I say so. Now coming to Jwar in short, Jwalayati, the one burns or produces heat or temperature, is known as Jwara, also known as Yamatmak or Mrityu, that denotes its severity or morbidity. And Prakruti, Pravruti, Prabhav, etc. already explained by Dr. Mehta sir, so I need not go to in details. So I would like you to keep in mind its Prabhav, that is Pranahar. That Vagbhatacharya has also mentioned Ojo Shan as Pariyay for Jwar. That means the one who eats or destroys Oja, the Paramadhatu Sar of our body. So it is really important, and we can see the impact of it. It is also known to be Pradnya, Bala, Varna, Harsha, Utsaha, Rasakar, and Shrama, Klama, Moha, and Ahar Avarodha Janak. That means patient finds difficult to eat or digest the food. Along with Sharir, Man is also considered as Adhishtan of Jwara, because we can see that Man and Indriya also get involved in this Vyadhi. Dosh and Vyadhi known to achieve maximum bal during respective hours, as said here, the Vayohoratri, Bhukta, and Rutu. That is respective hours during age, day, night, and season, as Tenta Madhyadika Kramat, Vata, Pitta, and Kapha. Charak says Jwara as just one entity, that is Santap, but later he classifies it on basis of Adhishtan, different Adhishtan, then Gunatattva, Jwarasya Veg, Sadhya Sadhyatva, Dosh Kal Bal, Ashray, and Karan, as explained in this slide. Now it is important to understand that each Jwara, say for example, Dosha Jwar, it can also present itself as Antarvegi or Bahirvegi, or maybe Dhatugat, or maybe Vishama Vegi. And patient can come to us in any avastha, may that be amavastha, pachamanavastha, or niramavastha, or maybe jirnavastha. Usually patient don't come in tarunavastha. They are habitual to take that antibiotic pill to suppress it, and later on when it doesn't get treated or cured, they come to us. So and thus these all are necessary to study thoroughly, as the principles of chikitsa changes at every level. Moving to next slide, let's understand what sannipat means. In short, many vyadhis are described or classified as ekadoshaj, dvidoshaj, and tridoshaj. Sometimes Acharya has used the term sansarga for combination of two doshas, and sannipata for three doshas instead of dvidoshaj or tridoshaj. As we know that Tridosh in Prakrut Sthiti always function properly, helping each other. Sama samam anuvartate. But when Vruddha or Kupita, they do work as per their physiology and may tend to cause disease, or may be found responsible for samprapti of that particular disease. But if not synergetic, they are called tridoshaj or dvidoshaj vyadi. Like 1 plus 1 is 2, and or we can say 1 plus 1 plus 1 is equal to 3. But unlike this, in Sannipat, all three doshas come together vitiated in such a manner that we can say the impact of that synergetic effect is in multiples. So there 1 plus 1 plus 1 will never be like 3. That may give you 5 or more than 5. Just an example to understand. And thus Sannipat are also known as dustar, that is difficult to cure or correct. Let's have a look at Sannipatik Jwar or Sannipat Jwar and its Nidan Panchak. The word, now let's look at the word Yugpat. It is very important. All three get vitiated at the same time in all their aspects. Then coming to Purvarup, Purvarup are same for all, as that dosha vyaktata is not achieved at that place or at that moment. And in Roop, again we get combinations of all three doshas as per Prakriti Samvay and Sam Vishesh Roop according to Vikruti Vishama Samvay, which we will see later. Upashaya is again then said to be achieved by doing everything that is Nidan Viparit, as we all know. And in Samanya Samprapti of Nejas Jwar, we will discuss it in next slide in detail. But in Sannipat, along with three dosha, multiple doshas can be involved than just Sveda or Rasa. It may follow and vitiate multiple dhatus and srotasas. Here again, Udbhav Sthan remains the same, Amashay, and Sanchar is Sarvanga Sharir, and Vyakti again depends on the involvement of Srotas or a Dusha, we can say. And then again, Dehoshma remains the same, a common factor among them. Coming to next slide, look at Nijajvara Hetu here. Looking at Nijajvara Hetu, that is Dosh Prakopak Hetu, consider the word Atisevan first. Ati Sarvatra Varjayat, we all know. Anything in excess can lead to illness. This is where our Pradnya helps us not to get indulged in anything to extreme or to extent. And Pradnyaparat can be avoided at this place. In Sannipat Dosh Prakopak Hetu, we can see in Aharaj, Vishamashan, Anashan, Vishopahat Udak are explained. This Anna Parivartan means sudden change in our daily diet or routine diet. In Vihar, Asatmya Gandha and Giri Upashlesh are described. Asatmya Gandha includes patients who are exposed or who are working in chemical factories, or that may be excess use of strong perfume, something, all sort of things can be considered under this category. And Giri Upashlesh indicates sahas, any sort of adventure which is beyond your strength or limit can be considered as sahas. Then Mithya Yoga of Panchakarma are also said to be the Nidan of Sannipata Prakop. Improper mode of delivery, post-delivery complications, not following Sutika Paricharya may lead to Sannipata Jwar. Now here is one word I want you to see, that Rutu Vyapat. Now Rutu Vyapat is like the one we faced in last few days, rain in winter. This Rutu can be considered as our season as well as a Sharir Rutu. Let's take for an example, in Sri Sharir, any irregularity or disorders related to monthly menstrual cycle should also be considered under this Hetu for Sannipata Jwar. Now moving to Samprapti of Jwara. This is Samanya Samprapti of Nija Bhed of Jwara. We all know that vitiated dosha, when enters Amashay, gets mixed up or we can say messed up with Ushma, that is Jatharagni, and along with it they follow Adya Ahar Parinamkar Rasadhatu. This Apachit Ras or Am then causes obstruction in normal functioning of Rasavaha and Svedavaha Srotas. During this all procedure or a process, we can say, this suppressed Jatragni losing its normal functioning, then follows this dosha sahita amarasa, we can say, and comes out of its normal stan in terms of ushma, and then it circulates through these through rasavahi srotas, we can say, or along with rasa dhatu, apachit rasa dhatu, all over the body, causing increased temperature and giving rise to jwara vyadhi. Here, in case of Sannipat, it starts with three dosh, all three doshas vitiated together. That's Yugapat Prakopavanta, and then spread throughout the body, involving other doshas as per Kavaigunya. Let's have a look at Jwarasya Purvarupani. Most of them, we can say, give idea about the presence of ama, dushti of rasadhatu, srotorod, and agni daurbalya. But apart from them, there are some manas lakshanas also, which indicates rasadushti as well. These highlighted ones are important to consider, I feel, because that kind of irritation or restlessness is found to such an extent that a patient feels hatred towards children too. It is not obvious thing, and may disrespect his own guru too, and this because of vaichitya, arati, glani, and indriya vikalta. Patient himself is not much aware of his own behavior, we can say. Looking at the time limit, I'm not discussing samanya roop of jwara, because doshanurup its presentation is understood, vatak, paitik, kafaj. And as said earlier, Prakruti Samasamvay can be understood in combinations of those doshaj lakshana. So let's directly come to Sannipat Bhed. Charakacharya has described 13 Sannipat, out of which one is Samma Sannipat, that indicates equally vitiated three doshas, and 12 are Vishama Sannipat. Three are out of them, three are one dosholban, three are dvi dosholban, and six are other combinations of ek ulban dosh, ek madhya, and ek heen. These names are given in Bhav Prakash, and some extra 13 in Bhaluki Tantra as well. We'll see them later. Charakacharya has described beautifully in Chikitsastan, each of them showing different pattern of jwara. Now, we can say these shlokas from Charak Samhita. One may ask, is learning these many combinations of sign and symptoms, is it so important, and where to use and why? And why not just follow the usual Chikitsa Sutra, Langanam, Pachanam, so on, and get result? But let me explain. All these sets of sign and symptoms help us to identify the anshamsha kalpana of dosha, and if treated accordingly, will yield or will give excellent results apart from Sannipat Chikitsa Siddhant Sutra. Even many granthas have given specific yoga for these types and so on, and can be used very well. Now, those who have worked in ICU or handled emergencies can correlate these signs and symptoms in many terminally ill patients, we can say. These combinations gives us, we can say, hope to handle such situations too. You may find jwara everywhere after learning Sannipat, I feel. Now look at Bhav Prakashokta Sannipat. There are 13. Among them, few we can relate with commonly found fevers types. For example, sign and symptoms of Shitanga or Tandrik, that resembles to that of typhoid. Then Pralapak Chitta Brahma may make you think about febrile delirium. Then Raktashtivi, Bhugnanetra, and so on. There are many. Even Sandhika Sannipat is also found commonly where there is joint pain and fever and no any other complaint. Ativistar Bhayat, I have not discussed these here in detail. You can have a look at those later. Let's have a look at Samma Sannipata Jwara. though rarely found and difficult to treat, as mentioned earlier, may yield good results if Samprapti is correlated in case of patients with poor prognosis. Here we can see Kshane Daha, Kshane Shita. Patient sometimes feel hot, sometimes very cold. He gets pain in Asti, Sandhi, and Shira. Then eyes become watery, a turbid look of the eyes, and sometimes redness is found. Uh, then Saswanau, Sarujau Karnau, ears may patient may complain tinnitus or the swelling and pain near ear. Then even his throat feels like it is filled with some pointy things which continuously pricks from inside. Then Tandra, Moha, Pralap. See, many of them are just like the scenario we usually see in ICU or terminally ill patients, as I said or mentioned earlier. Then Kasa, Shwasa, Aruchi, Brahma. The tongue is very rough and we can say the patient can feel the roughness of the tongue. The body feels like lethargic. Then sometimes he may spit reddish rakta pitta or sometimes with along with kapha. Then Shirasolotana Trishna Nidra Nasho Rudivyata. The patient suffers a lot that he gets tired of the symptoms. Fatigue is seen. Then the Malapravruti is less in quantity and sometimes not so frequently. Sweda Mudra and Purish. Then even the body uh, we can say the patient loses weight continuous that kanta kujan that a sound of from rs is observed. Patient may sometime present with rashes over body. Then mukatva is again a very significant symptom shown here. Srotasam paka, here this srotas means bahirmukha srotas, mukha pak, nasa pak is observed. Gurutvam udarasya, again GI disturbance is there. Patient may complain advan, atop. And this is important. Chirat pakasya doshanam sannipata jvarakruti. Usually in all kinds of fever, when dosha paka is achieved, patient likely to get relief from the jwar. But if it leads to dhatu pak, then the dosha pak, patient goes in some sort of upadrava or complications we can say. So it is important to keep an eye on what patient presents with the symptoms, signs, and all. Now again, Abhinyas Sannipat is explained in Sushrut Samhita. It is somewhat similar to Samasannipat. I'm moving to next slide. Sannipat Jwara is said to be asadhya when dosha are vibhaddha, agni is nashta, and it is presented with all sort of signs and symptoms. Otherwise, it is said to be krucha sadhya, but not sadhya. So it is important to mark this sentence that it is krucha sadhya and not so easily curable. Now we come to the chikitsa part of jwara. This is Samanya Chikitsa. It's applicable to all Nija types of Jwara. And again, it's not mentioned here, but I must tell, and everyone knows that Nidan Parivarjan is again the first line of treatment to break the chain of Vikrut Dhatu Santan Parampara as per Swabhav Paramvad. So Nidan Parivarshan is the first thing. Then in Sushrut Samhita as well as in Bhaishajya Ratnavali, Jwara Chikitsa is mentioned in Purvarup itself, Jwarado, or when the Purvarupas are appearing, Lagvashan or Apatarpan is said to be followed. If Dosha Laghav is there, they say Lagu Bhojan should be taken, and if Dosha Gaurav is there, Langan is must, and then Virejan, followed by Virejan. And Sushrut Samhita, they say Vataj, in type of Vataj Jwara, Acha Grutapan should be given so that Raukshatva can be taken care of, and then later on that dhatu kshay can be avoided. In Pittaj, Mrudu Virechan is given, and in Kafaj again Prachardan is given. Now here comes the Samanya Chikitsa. Initially Tarun Jwara is explained, As we know, this famous Chikitsa Sutra, Langanam. The first is Langan. It helps to reduce that vitiation of dosha, we can say. Dosha Kshaya is achieved with the help of Langan. Then Agni Sandukshan is achieved. It itself is a Jwaragna. Vijwaratva is achieved. Then it gives Laguta to body and Kshudha is improved. But again, Shastrakaras emphasize that it should be Prana Avirodhi. Not everyone can follow the Langan. In case of Kshina patient, if patient is Vata Prakruti or Vata Jwar is there, Langan should not be given. And if given, there are complications we need to face. Then comes the next comes is Jalasevan. Here they again have explained the importance of drinking hot water. And in case of Pittaj or Rakta Pitta or Madhya Janit Trishna, they have advised to have Tikta Siddha, Tikta Aushadhi Siddha Jala, like Shadangodak. Then Vaman is advised only and only if Jwaropadak dosha, if they are at Amashay and they are in Utklishta Avasa, then only Vaman should be given. And then they say ki after Langan, Yavagu should be taken till 6 days if the or till when Jwara is reduced in symptoms. And in patients where Yavagu can't be given because they are Ushna Tikshna, in Rakta Pitta, Madhya Janit, and all the way I said earlier, their Tarpan can be given, Madhura Aushadhi Tarpan, not Aushadhi, but Laja, Parushak, etc. are used for Tarpan. Their Peya Manda can be given. Then comes Kashaya Pan. Actually, Kashaya is not advised in Taruna Jwara, but once the dosha or Niramavastha is achieved in terms of dosha, Kashaya can be given. And even after 6 days, 7 days, doshas are tend to be Sama. Pachan Kashaya should be administered first. And if they are Niram, Shaman Kashaya can be given. After 6 days, they have advised Lagu Bhojan on 7th day, and 8th day onwards, Kashaya Prayog can be given. That means Shamana Aushadhi also can be used after once the Taruna Jwar Avastha is gone. In Tika, they have advised 6 days as per Dosha Bala Abalatva. Peya 6 days, then Kashaya 6, then Sarpi, Kshira, and Virechan respectively. Again, once Niramavastha is achieved, Grutapan and Dugdapan can be given, which is also said in Jirna Jwara Chikitsa as well. Dugdapan if Daha and Trishna is there, and Grutapan only if Kapha is Manda. If Kapha is Utklishta or in Prabalavastha, Grutapan should not be given. Then for Shodhan, Panchakarma is advised. A variety of combinations are given for Vamana, Virechan, Anuvasan, and Nasya for Jwara in detail. And even for Bhaiyopachar, Charakacharya and other Granthakaras have also advised many different kalpanas for Snana, Abhyanga, Pradeha, Avgaha, etc. And it is really a feast to read such a descriptive chikitsa for this Vyadi, and this is why they have mentioned this Vyadi at first in detail, so that same way chikitsa pattern can be followed in detail for other Vyadis too, because at every stage they have mentioned what to do, what not to do, and what will happen if done, what will happen if it's not done, what can be the complications, and how to tackle them. So wonderful chikitsa adhyay Jwara has contributed to. Then comes Ahar Kalpana. Again, variety of Peya, Manda, Vilepi, and all this Kramasha explained, not at once Mamsiras and all, but very well explained in Chikitsa Sthana about Ahar Kalpana. Then Daurbalya Deha Dhatunam Jwaro Jirno. I'm explaining all this because even Sannipata Jwar also undergoes these avasthas, Taruna as well as Jirna. So in short, I'm explaining because I know the time limit is there. Jirna Jwara as explained, Daurbalya Deha Dhatunam Jwaro Jirnonu Varatate. So this Deha Dhatunam Daurbalya is important to remember. So for again to regain that dhatu bal, Ghrutapan, Dugdapan is advised. Even Niruha is advised this stage. Anuvasan, Abhyangadi Bhayopichar can be done. And Shamanaushadhi, variety of Shamanaushadhis are explained. There are many yoga in granthas like Jwara Bhairav Ras, Jwara Nag Mayur. Many Vasanta Kalpas in Jirnavastha are explained. Jwara Bhairav, Jwara Nag Mayur have you can see the Falashruti of few Jwaragna yoga given in Vaishajya Ratnavali or any other granthas. You can see the Falashruti. It explains each and every type of Jwara, each and every avastha of Jwara, each and every sthana kala of Jwara. So wonderfully explained. I must say everyone knows this, but we should follow that Falashruti pattern because this gives you idea which kalpa should be used in what pattern of Jwara. Say if Shwasakasa is there, there is a Yavagu mentioned, Parikartika is there with Jwara, a Yavagu mentioned for that. So different combinations can be used at very unique way in say every patient it can be different. Coming to Punaravartak Jwar, then again we know that Sanjata Balariyastu जिसका बल पूरा totally regain नहीं हुआ है and again he doesn't follow the pathya and something some nidan is again administered or nidan sevan is done, the jwara again comes, that is called Punaravartak Jwar. We know that remission and relapse. So it's sort of that. In this Punaravartak Jwar again, Granthakaras had advised Mrudu Shodhan because that Alpa Shishta Dosh, Avashishta Dosh can be taken out through this. Then Yapan Basti to maintain the Bala of Dhatu. Lagu Yush, Jangal Mausiras. This is again Kramasha to maintain the Agni. And then Abhyanga, Udvartan, Snana, Dhupanjan. These will take care of Bayoshmad. Even in Sushrut Samhita, they have said that Abhyantaropchar ke baad bhi Bahya Upchar are must because even there may lie some Avashishta dosh in skin. Twak sthit dosho ke liye, they have explained Bahya mainly. Then Tikta Grut, Tikta again is very important ras when we consider Jwara Chikitsa. It is said to improve Dhatvagni mainly, so it is important. Then Kirat Tiktadi Kasha is famous. This is also widely used in practice when patient complains relapse of fever or recurrent fevers again and again, seasonal variation and all. There Punaravartak Jwar Kashai can be used. Now we'll come to Sannipat Jwara Chikitsa. वर्धनेन एकदोषस्य क्षपणेन उच्छ्रितस्य च कफस्थानानुपूर्व्या वा सन्निपात ज्वरम जयेत्. We all know this. They have explained that this is very important and should be treated carefully because all three doshas are in vitiated form. So what we say ki taratamya is very important while treating doshasya ulbanata. That one which is increased should be pacified and the one who's heen or is not so much vitiated should be increased, but we should maintain the balance that kapha should not get prakupit because it is the main stan of jwara, the udbhav stan. Kapha sthananupurvya, they have said. In Chakradatta, they have mentioned Langanam Valuka Svedo Nasyam Nishtivanam Tatha Avaleho Anjanaschaiva Prak Prayojam Tridoshaje. Langan as explained everywhere. Then Valuka Sved. He has mentioned that Svedan is must to release the Sroto Roth, and so we know that Gati of Dosha, Vidya Vishandanat Pakat, the Sveda helps those dosha to get back to kosher and then gets pacified. So Swedan is important. Chakradatta has emphasized on Swedan. Then Nasya has to be given in case of patients with Saudnya Nash. In emergencies, as I said earlier, in such conditions, Tikshna Nasya, Tikshna Anjan can be administered. Avaleha also and Nishtivana. Prak Prayojam Tridoshaje. उस त्रिदोष ज्वरों में सबसे पहले ये करवाना चाहिए. He has said पूर्वम आम कफापहम kapha and ama. They are the main factors, so they has to be taken care of. And then पश्चात श्लेष्मणि संक्षीणे शमयत वातम marute. Once the shleshma is kshina, it is achieved that shleshma is pacified, we can take care of vayu. Then agni karma is also described in Chakradatta, that if patients come with Sannipata Jwara in Saudnyanash Avastha, we can use Loha Shalaka for Agni Karma, and it can be done on Lalata and Padatala. Now, as we all know, this Upadrava of Sannipata Jwara, Karnamule Sudarune, the Shota Sanjayate Tena, Kashtideva Pramunchati. Again, this can be correlated with the mastocytitis, which may then lead to meningitis and fever. So it is difficult to cure, and it is said to be Kashtideva Pramunchati. कोई एक ही बचता है इसमें, कभी कभी बच सकता है patient. It has very poor prognosis. Morbidity case level is more. And treatment advised is Raktavasechan, Sarpipan, Gritapan, that is. Then Kapha Pittagna Pradeya has to be given, and Nasya Kavalagraha. And this slide is from this slok from Sushrut explains that Sannipat Jwar can be Dhatugat as well, and Vishama Jwara is also said to be Prayasho Sannipatenas. So we should consider Vishama Jwara as well as Dhatugata Jwara while treating Sannipat. So I'm not going into detail because we all know Vishama Jwara and Dhatugata Jwara. I just want you to remember or to look at this just for one thing. This is one of the important slide which explains ashray of all these five. Santat, Satat, Annedyushka, Trutiyak, Chaturtak. Here only at place of Mamsa, Charakacharya has said Medova Sira. And Kafasthana in Sushrut Samhita, they have explained that Santat is when dosha are at Amashay. Then when they goes to Hriday, it is kind of Sattata, because dosha takes time to come back to Amashay and go back to Hriday. So that's how the peak of the Jwara during day is, they have explained according to the Kafasthan, from where dosha come and go. Amashay, Hriday, Kantha, Shira, Sandhi, respectively, in all these five types of Jwara. Now comes the interesting part. These Vishama Jwaragna Kashayas are also very excellent yogas, just like Charakokta Mahakashaya. We use so often and easy to use. One may not need to understand the Samprapti or Lakshan, or may not need to name the Vyadi. Nahi Sarva Vikaranam Namosti Dhruvastiti, as said. So likewise, here also, though given for Vishama Jwara, practically can be applied to many other diseases, as the main aim is to improve Agni. Improve Dhatvagni, to be very specific. These are popular Dhatu Pachak yogas practiced every day in almost, I guess, in many clinics. As we know that Dhatvagni is important factor to digest the prior Dhatu, and that gives nourishment to the next Dhatu. And their byproducts, so we can say it produces Upadhatu and Mala. So the interesting part is these can be very nicely or excellently used in several conditions where respective Upadhatu and Mala are involved or vitiated. For example, Rasapachak can be used in all types of Rajovikar and Stanya Vikar. Raktapachak can be used in Pakshaghat or Ardit where Sirakandara are involved, and so on. If I go into detail, it will take a lot of time. Moving to next. As main three things it can do. I mean, I just want to take a bit time just to explain why I like those Vishama Jwaranta Kashaya, because first of all, it improves Dhatvagni. So accordingly, we can use in many diseases. Secondly, it can be used in Dhatugat, Dhatvashrit, Dhatu Pradoshas Vyadi, as well as Upadhatu and Malavyadis. Malavyadi means the Vyadis which involve respective Upadhatu and Mal. And thirdly, it can be also used as vehicle, not like Anupan, but a kind of vehicle which carries certain medicines to that respective site or that certain Dhatu. So it is wonderful. One must try. Then moving to next slide, same way, Dhatu ka Jwar and Chikitsa can be studied in practical point of view, as only few vyadis like Jwara, Kushta, Masurika, and Vata Vyadi, they have Dhatu Gatatva. So accordingly, practically, we can think about these. Just a, I can say, food for thought. Moving to next slide. In modern medicine, these are the main causes of fever. If studied well, and if can be correlated and treated well with Ayurvedic medicine, I feel, depending on the kala, I mean, when the patient comes or in which avastha he comes and what sort of signs, symptoms he comes with. Main four causes are infection, inflammation, autoimmune disorders, and malignancies. I won't go into much detail, but still, till now, these are the important factors till now which are to be kept in mind while studying or treating Jwara or any Vyadi we can say, but these are the main factors in Jwara, in respect of Jwara. First of all, Prakupit dosha, second is Agni Mandya, third is Am, Srotorod, Dehoshma, and very important, Dosha Pak and Dhatu Pak. These, when we treat any patient of Jwara, we should always take care of all these factors. Let's have few examples of diseases where we can get to see Sannipata. Many viral diseases have do present a scenario like Sannipata Jwara, for example, COVID-19. Let's see this example. I'll not go into detail again as it's already very well explained by Dr. Singh sir, I guess just few days back, and others too. I just want to say, apart from being Sannipata, or we can say Outpasargik or Janapadodvamsa Vyadhi, it may change its scenario after some time. So, diagnosis or dosha combination may change patient to patient, or in every patient too. In single patient too, the scenario changes. Uh, this virus is just a Vyanjak Hetu, we can say, or Dinacharya, Rutucharya, Sadvritta plays very important role to maintain the Vedic Shamatva. And that's what explains why 80% of infected cases or positive cases are seen to be asymptomatic. If we see number of sign symptoms and involvement of systems in this disease, it can be correlated to first of all Vata Kafolband Sannipat at the initial stage. Later on, that becomes Vata Pitta Ulband Sannipat because that Pitta is known to be Ashukari. Vata is Yogavahi. He goes everywhere. But Pittasya Ashukaritva may cause Dhatu Pak. So that's why many times when the Samprapti is very in rapid progression or Ashukari or sorry, not Chirakari, Ashukari or fast developing, we must consider Pitta because it is responsible for Paka, Pachana, Parivartana. So that factor has to be considered while looking at COVID's patient in later stages. Even Karkatak Sannipad, Kantakubjak Sannipad, Shwasanak Sannipad, they are also which are mentioned in Bhav Prakash. The sign and symptoms resembles to COVID. So if the patients arrives with any of these symptoms, we can use respective yogas mentioned in Granthas. So here also Tridosh has to be there. The involvement of all three doshas is there. Mainly Kapha Dushti because the site or the where it enters and affects the respiratory system first. So it has to be Kapha Dushti first, then later on that coagulopathies and that can explain Rakta involvement. Then patient goes in very critical condition easily. That's because that Oja is affected and Dhatu Pak is achieved. So here again also we need to keep in mind about Agni, Trimarma Raksha as explained by Dr. Taide sir in last lecture. So important is to consider Trimarma Raksha and Rasayan in post-COVID complications also, where it involves respiratory, cardiac, renal, neural, and many of GI symptoms. So it is important. Then moving to inflammatory disorders and autoimmune disorders. There again, we can take an example of mm, Sandiga Sannipat, as explained in Sahita, that it is very commonly, it can be used in patients who complain fever with joint pain. Not all joint pain and fever are amvat, or uh, we can see that the symptoms given in Sandhika Sannipat a bit resembles to rheumatoid arthritis and chikungunya, or even rheumatic fever can be considered or correlated with the Sandhika Sannipat. So one should consider this yoga or this type of Sannipat in such patients with where inflammation is there, autoimmune disorders are there. Even we can see if the patient doesn't get good relief with amvat chikitsa, we must try Sandhiga Sannipat, and maybe that will give good results. We can try because there are sometimes Vyadi Sankar is also there. At same time, there may be other sampraptis are also going on in the body. So Sannipat is very important topic to consider while treating such patients or conditions. Moving to next, malignancies, Gulma, Granthi, Arbud. Wherever there is a growth, it's not likely to always present with symptoms. Most of the time, CA patients never present any symptoms unless and until they are spread. Localized रहते हैं तब तक pain भी नहीं रहता है, कुछ symptoms भी नहीं रहते. But once spread, they show a very fast, or you can say rapid progress, and the condition gets worsened. So in such cases also Sannipa Jwar should be considered. It should be thought of, because as we have seen in Jirana Jwara, those lean um, dosh suppressed by some antipyretic medicine, or wrongly treated Jwara, these lean dosha may keep accumulating in the body and may vitiate suddenly if they get some hetu. Udrek achanak se ho jata hai, and same samprapti can be seen in gulma also, nichaya gulma. Three increased or vitiated dosha सेम समसमान होते हैं तो भी उद्रेक नहीं होता है, बट संप्राप्ति होती रहती है अंदर. इन मराठी विषय वादळा पूर्वीची शांतता. So suddenly something happens, and patient doesn't know how it happened and when it happens. So in such condition, it's just an example. In such conditions also we can consider Sannipata Jwara. And I'm coming to the end of the presentation. I'm sure I'm not so late. PCOD and Sannipata. This is one interesting thing. You can see the shloka next to in the slide. It is from Madhukoshtika, where they have explaining Vishamajvara as well as Sannipata, where they have mentioned that Ardha Narishwara or Narasimha Akarena, where the dosha when present in the body, if uh, half of the body is half of the body is hot and half is uh, cold, either upper, lower, or left and right, just like Pakshaghat. In such cases, we must consider cases where this thing happens, like Pakshaghat, they have already said. Just take an example of PCOD, where Agneyatva and Saumyatva, that is Stritva and Purushatva, is seen in same patient. Though she's a Stri and she should have that one bhav, but she presents with increased androgen level, then hirsutism. In such cases, we must consider that something is wrong with rasa dhatu first of all, because rasa gives rise to raja and then stanya also. So if raja is affected, rasa has to be considered to be affected. So rasagni has to be improved. And Granthi Raja is also should be considered while treating patients with PCOD, because that Granthi can't be without Vata and Kapha Dushti. Here again, Sannipata Jwara should be considered, and Ardhanarishwar Rasa is explained and here in Basavarajya and also in Vaishyaja Ratnavali, which can be given in such conditions where Stritva and Purushatva is found in same patient or female. Here again, I can say many patients in practice also comes complaining irregular periods, delayed periods, where if asked, they answers कि yes, periods के पहले हल्का सा बुखार लगता है, feverish feel is there. So again, we should think about punaravartak as well as dhatu gatatva of jeerna jwar, because that cyclic fever where lean doshas already has to be there, and then when some certain condition is achieved, that jwara expresses its roop, that irritation, irritability, or and restlessness or manasantap is seen in patients prior to period, female patients specifically, because of this rajadushti, where sanipata jvara should be considered while treating such patients. Because as I said earlier, rutu is considered seasonal as well as स्त्री शरीर में जो periodic ये रहता है cycle, there we should think about Rutu Vyapanna, and because of that, the Sannipata Jvara. So here ends my part of presentation. I hope I haven't missed anything, and taking care of time because of time limit. I just okay. Sir. Thank you, sir.
Thank you very much, Mrudula madam, for being so precise over fever. And exactly you have said that when we were studying, so by the time the Jwar Adhyay starts, and by the time we read to Sanipa Jwar, everybody was getting fed up of Jwar every time. And we would have missed a big part if we haven't studied properly. And you have covered all type of jars very precisely, right from the Vata Pitta Kapha, then to autoimmune, and then the partial and the PCOD. So thank you very much on behalf of us. And I request Dr. Vinayak Tade sir to give a few comments on this.
आज का जो विषय था सन्निपात ज्वर चिकित्सा। सन्निपात ज्वर चिकित्सा जब हम कहते हैं, उस समय एक बात ध्यान में आना चाहिए कि सन्निपात ज्वर चिकित्सा में वर्धनेन एक दोषस्य क्षपणेन उचिताक्ष कफस्याने पूर्व्या सन्निपातम ज्वरम जयेत, ऐसा जो चिकित्सा सूत्र बताया है कि एक दोष को बढ़ाना है, दूसरे दोष को कम करना है। इस प्रकार की चिकित्सा जब हम करते हैं, जैसे कफ दोष को बढ़ाते हैं तो अल्टीमेटली वात और पित्त दोष का क्षरण हो जाता है, क्षय हो जाता है। लेकिन इस प्रकार की चिकित्सा करते समय एक बात ध्यान में रखना चाहिए कि इसी प्रकार के दोष रोगों का निर्माण जो होता है, सन्निपात ज्वर का जो निर्माण हो जाता है वह कफस्थान से होता है। तो कफस्थान की चिकित्सा करना इंपॉर्टेंट रहता है। कफस्थाने पूर्व्याः सन्निपातम ज्वरम जयेत, तो कफस्थान की चिकित्सा करनी चाहिए, आमाशय की चिकित्सा करनी चाहिए, और उसी के लिए लंघन और पाचन चिकित्सा इंपॉर्टेंट रहती है। तो सन्निपात ज्वर में हम कफोलबन जो रहता है, तो उस समय कफ की चिकित्सा जब हम करते हैं, मधुर रसात्मक चिकित्सा करते हैं, तो उस मधुर रसात्मक चिकित्सा करने से कफ बढ़ जाता है, लेकिन वात और पित्त का क्षय हो जाता है। लेकिन यही करते समय एक बात ध्यान में रखना चाहिए कि कफस्थान की चिकित्सा अत्यंत आवश्यक होती है, जिसमें हमें लंघन और पाचन करना चाहिए। एक पॉइंट। दूसरा पॉइंट है कि सन्निपात ज्वर में जब उपद्रव निर्माण होते हैं, विभिन्न प्रकार के उपद्रव निर्माण होते हैं, जिसमें सबसे त्रस्त, भयंकर, अत्यधिक अवस्था निर्माण करने वाला या मृत्यु सूचक लक्षणों की अभिव्यक्ति करने वाला जो उपद्रव होता है वो कर्णमूल शोथ, इसमें अत्यधिक अवस्था आती है। अगर इसकी हम चिकित्सा नहीं करते हैं तो पेशेंट 3 दिन में मृत हो जाता है। तो इस प्रकार के अवस्था में चक्रपाणी और चरक जी ने लिखा है कि रक्त मोक्षण इज मोस्ट इंपॉर्टेंट, आफ्टर दैट घृतपान इज नेसेसरी, क्योंकि रक्तमोक्षण जब हम करेंगे तो अल्टीमेटली शोथ कम हो जाता है और उपद्रव जो आधा उसके कारण जो मृत होने की संभावना हो जाती है वो कम हो जाती है। उसके बाद हम घृतपान करते हैं। यह सेकंड पॉइंट। थर्ड पॉइंट जो है, जब हम ज्वर की चिकित्सा करते हैं और ज्वर की चिकित्सा करते समय ज्वराद उल्लंघनम ज्वर मध्य तु पाचनम ज्वरांते विरेचनम, ज्वराद उल्लंघनम ज्वर मध्य तु पाचनम ज्वरांते विरेचनम, इस प्रकार की चिकित्सा करने के बाद ज्वर कम हो जाता है। ज्वर मुक्ति के लक्षण अभिव्यक्त होते हैं और ज्वर मुक्ति के लक्षण अभिव्यक्त होने के बाद मन इंद्रिय प्रसन्न हो जाते हैं, दोष शांत हो जाते हैं, देह में लाघवता आ जाती है, शिरो लाघवता आ जाती है। और उसके बाद अगर हम लोग पथ्य का पालन नहीं करते हैं, गुरु अभिसंधि उष्ण तीक्ष्ण शीत ऐसे आहार का सेवन करते हैं या आतप सेवन करते हैं या अत्यधिक गमन करते हैं या अति मैथुन करते हैं, तो फिर से ज्वर निर्माण होने की संभावना होती है। उसे हम पुनरावर्तक ज्वर कहते हैं। ये पुनरावर्तक ज्वर निर्माण नहीं होना चाहिए, इसलिए ज्वर के बाद पथ्य कल्पना जो बताई है, ये पथ्य कल्पना का प्रयोग हमें करना चाहिए। जैसे कि शास्त्रकारों ने कहा है कि यवागो लेना चाहिए, मंडल लेना चाहिए, तेया लेना चाहिए और इस प्रकार से आहार लेने के बाद अग्नि की वृद्धि हो जाती है। परिणामतः पुनरावर्तक ज्वर निर्माण होने की संभावना नहीं रहती। तो ये जो पॉइंट जो हमने जो बताया है, हाँ, वैद्य मृदुला ने बहुत ही अच्छी तरह से बताया गया है। और आज का जो व्याख्यान था जो मृदुला राजपूत ने दे दिया है वो बहुत ही महत्वपूर्ण और स्टूडेंट के लिए बहुत लाभ करता है। थैंक यू।
थैंक यू डॉक्टर ताड़े सर। जल के ऊपर आपका जो प्रकाश डाला आपने, इट वाज एक्सीलेंट। आई रिक्वेस्ट डॉक्टर श्याम शर्मा सर टू से फ्यू वर्ड्स प्लीज।
Thank you, Dr. Mehta. First of all, I would like to congratulate Dr. Mrudula Rajput. See, during this lecture, she mentioned 2-3 points, and I would like to highlight those points because those points are very much useful and helpful for students and all practitioners. And as we all know that this series is going for their benefit only, we are doing for their benefit only. So, ma'am, first point you mentioned that immediately or all of a sudden we are not getting this Sannipat Jwar. Gradually, when not treated properly, when not diagnosed properly, then every Jwar, all fever, they can turn into Sannipat Jwar. This is very good and important point for practitioners. And the second thing, nowadays, see, lecture was on this Sannipat Jwar, but madam mentioned PCOD and autoimmune disorders also. And she correlated this PCOD very nicely. She mentioned that Agni and Soumya, and in practice we see that different type of symptoms we are getting in PCOD cases. And nowadays it's a very common disease. We are getting such patients. So, ma'am, thank you. And you have mentioned about that रसाग्नि, मिस रसाग्नि हमें बढ़ानी चाहिए। ऐसे जो केसेज आते हैं उनमें रस धातु का ध्यान देना चाहिए। So thank you very much for sharing all these knowledge, practical knowledge, and it will definitely help all listeners. So I would like to thank you again, madam. Thank you very much. It was good, excellent practical approach lecture.
Thank you very much, Dr. Shyam Sharma sir. I request Dr. Pradeep Awale sir to say a few words about this.
Hello.
Yes, sir.
So as I told, I was not able to attend the entire lecture. I was
you missed a good thing
frequently. Yes, but it was nice to see Dr. Mrudula Rajput madam for second time, and she is very excellent in giving some practical approaches of this.
And she had worked very hard on this subject. This time, her slideshow shown that she had worked very hard.
Correct. That's why. So I should congratulate her, and I'm very thankful from behalf of Maharashtra University of Health Sciences, Nashik. and in future also, if you need, we will try to involve her in this lecture series. Okay, over to you, Mehta sir.
Thank you very much, sir. So once again, we are very much thankful to Dr. Mrudula Rajput, madam, for such a elaborate description on Sannipata, Jwar, Chikitsa, Siddhant, and Vivechan. Well, friends, we request you to send your feedback, suggestions, and observations in just a short video of just 1 minute from your busy schedule. And just WhatsApp it up on 98210-73911 and email drshymv3s@gmail.com and ayushmush@gmail.com. So friends, tomorrow will be our last lecture and it will be a grand finale presentation from all our listeners, our viewers, our teachers. And our tomorrow again, Bhishma Pitama of webinar, Dr. Vinayak Tade sir. And tomorrow's lecture, I request all Ayurvedic physicians and students, don't miss it. It's on a Nadi Vigyan, which you will get very less in the books, but you'll get much in practical. So let us see it, all of you tomorrow. And please note tomorrow's time change. Tomorrow the time will be at 2 o'clock in the afternoon, because tomorrow we'll start our Vinayak Tade sir's lecture at 2 o'clock, and then after there will be presentation, finale presentation. So hope to see you all tomorrow at 2 o'clock with Dr. Vinayak Tade sir, and for a grand finale presentation. Stay safe, take care. Thank you very much.
Thank you, everyone. Thank you, everyone.